Let me give you a brief idea about adjustment disorder as a candid discussion rather than going into the theoretical. This, yes, cycloid psychosis has been asked once. I didn't discuss non-schizophrenic psychosis, in which one of them is cycloid psychosis. Bofi delirante, did I talk? In my colleagues was asked in Viva, Bofi delirante, cycloid psychosis, reactive psychosis, Jasper psychosis. And so he was asked to name non-schizophrenic psychosis. All the non-schizophrenic psychosis. These are typical Viva questions. Boulder I have not heard in Viva because maybe in my professors did never asked about it. Not much details are given on this in the books also. These are those Viva questions which they ask you when you are answering nicely, and then they have to bold you that by throwing a Viva question which you shouldn't answer. Okay, fine. Let me explain adjustment disorder. When we talked about depression, we always talked about, this is nothing to write. We always talked about that depression may be endogenous without a stress factor or exogenous with a stress factor. Actually, since long it has been debated that endogenous is the biological depression and exogenous is the psychological depression. So you can rather say this is gene, this is environment, but nowadays we are talking about gene and environment combined hypothesis in this. We are talking about gene and environment combined hypothesis in depression. We do not talk of only neurotransmitters. We do not talk of only stress. We do not talk of only genetic predisposition. We talk about environment as well. So what I am trying to say is, long it has been debated that reactive depression is nothing but adjustment disorder. What is adjustment? In simple, stress leading to depressive symptoms. But what is the major important thing to catch here? The major important thing to catch here is this depression will always be a mild moderate depression. This is a candid discussion, nothing to write. This is just an explanation. This is just an orientation to the chapter. Suppose a boy failed in an exam, after which he became sad, depressed, not feeling like doing anything. If it is having a temporal correlation that he failed in the exam in January and the symptoms started in February, let's say within 15 days or 20 days, I will write the formal diagnostic criteria, but the symptoms must not make be sufficient to diagnose a major depressive disorder. It is written in the diagnostic criteria of adjustment disorder that if the symptoms are sufficient enough to warrant another mental disorder, mainly major depressive disorder, you cannot diagnose adjustment disorder. This is where the viva and the leg pulling will go. You might have a case of stress following depressive symptoms. Now you tell me whether it is adjustment disorder or depression. If there is no stress and depressive symptoms, you will say it is major depressive disorder. Agreed. But if it is stress and depressive symptoms, suppose you get a case in the exam, a lady lost her husband, after which she is having depressive symptoms. So what are your points which will go in favor of adjustment disorder? What are your points which will go in favor of depression? That's why we need to learn this chapter, because if we get a case of depression, the viva will go in this direction. Do you get my point? If we get a case of major depressive disorder, our viva will go in this direction. Do you get my point? Why I have selected this topic? I have hardly seen any theory question asked on adjustment disorder, but I have hardly seen any viva where they don't ask adjustment disorder. Do you get it? It is purely a exam practical case related topic which I am teaching today. Are you getting my point? मेरी बात जरा ध्यान से सुनो. एडजस्टमेंट डिसऑर्डर पर थ्योरी सवाल मैंने नहीं देखा है, बहुत रेयर होगा अगर आता होगा. In fact, the matter given in on adjustment disorder when I was reading Kaplan yesterday, it is not. It was very insufficient. Hardly 3-4 pages in synopsis, and in the new synopsis they have not even given independent adjustment disorder. They have merged it into trauma and stress related disorders. But in Viva, they always ask, how did you differentiate it? Stone Cold Steve Austin, not necessary. Suppose your past history was of major depressive disorder and this depressive episode is adjustment disorder. Is it possible? Stone Cold Steve Austin is saying that the patient had a past history of major depressive disorder. If the past history is major depressive disorder, then after stress this episode has to be major depressive disorder. It can't be adjustment disorder. This is what he is saying. This is a new hypothesis I am hearing. I am not countering you, but I am asking other student, is this hypothesis true? There's a student, I don't know his or her name, he has kept it at Stone Cold Steve Austin, because it's my duty to correct all of your concepts. He is saying, sir, if there's a past history of major depressive episode, then the current episode even after stress is major depressive disorder and not adjustment disorder. Do you agree? Is there anyone who has read this? Is there anyone who can prove it? Maybe you are right, but I want others to authenticate this. Okay, Suraj Singh is saying duration of symptoms. Okay, what do you wish to say about duration of symptom? Suppose in this also duration is more than 1 month, in this also duration is more than 1 month. Suppose if you say onset, this also started within 15 days of stress, this also started within 15 days of stress. Now differentiate, Suraj. These type of questions are very, very common in Viva. I am telling you, you get a case of depression, they will pull you around this. One day I very much wish that someone among you presents me a case and I take a mock Viva. But I don't want to, sound like a bad examiner. But one day I wish that someone among you presents me a case and I take a mock Viva and I tell you what all questions and where all the examiners go. Life event necessary. I say life event is present in both. Now tell me. Yes, Aditi, previous concept was, as an undergraduate, if suicidal thoughts are present, then it is more towards depression. But a recent study has found that adolescent adjustment disorder can also have suicidal thoughts. You are close but not absolutely correct, Aditi. Different in severity of symptom and symptom wean off if the stress is removed. This is important. Dhara Patel, but till we do not confirm it that the symptoms have weaned off, till that time how do we diagnose? Dhara Patel answer is almost correct. He is saying that symptom must go after removal of stress in adjustment disorder. Anant is saying severity of symptoms. So I just want to know what severity you are talking about. Absolutely correct, Devashish. Absolutely correct. The criteria of MDD is not met. The criteria of MDD is not met. You have to check whether the depressive symptoms meet 5 out of 9 for 2 weeks MDD, then MDD. If they do not meet 5 out of 9 to 2 weeks for MDD, then adjustment disorder. Very, very simple. Very, very simple. Because adjustment disorder is a diagnosis of exclusion. You must rule out major depressive disorder, then only you can come to the diagnosis of adjustment disorder. If the student answers this in the Viva, he gets marks. All other answers, they will keep on pulling you. Suppose the answers you have given, Anant, within 3 months of the stressful event. Suppose within 3 months happen, then also how will you cross-sectionally diagnose adjustment disorder and depression? Yes, All of you what you are saying is this onset, and all of you what you are saying is after removal of stress. This will not improve, this will improve. I accept this answer of yours. I accept this answer of yours, but this is after removal of stress, na? What if you were unable to remove the stress? A boy is sad after death of mother. Is the stress factor removable? A boy is sad after death of his mother. Have you seen people going into depression after loss of family members? How will you differentiate that case is adjustment disorder or depression? Yes, Krishnendu. Previous definition was that adjustment disorder has mild moderate depression, and depression per se has severe depression after stress. But Krishnendu, the problem is that there is no clear guidelines of what is mild, moderate and severe depression. Do you remember me teaching you this? Mild, moderate, severe depression. Mild has 1, 2, 3, severe has 1, 2, 6, moderate has 1, 2, 6 symptoms, 4, 5, 6 added, and severe has 7, 8, 9, so 1 to 9. But these guidelines are as per ICD. DSM doesn't have any proper written guidelines of mild, moderate, severe depression. No, Stone Cold Steve Austin. If MDD and adjustment disorder are comorbid, you cannot diagnose adjustment disorder. You have to say it is MDD. Because for adjustment disorder to be diagnosed, MDD must be ruled out. Do you all get it? Can I start the proper theory writing notes now? This is your Viva. I will discuss more Viva points. Aditi, that sounds like a good idea. What I can do is, in between your theory and practical, these classes will get over. Can I take a Zoom session at that time and someone among you presents a case, a final year student, and not present a case, just a brief history, and I can tell you where you can be trolled, where you can be pulled, what are the various questions we can do, we can plan it. Let me finish what all I have supposed to, then I'll go ahead with that. Okay, so going back to the topic. So as expected, I will be covering this topic under my basic headings. So first is the definition. Second, I will talk about epidemiology. Third, I will talk about etiology. Fourth, I will talk about clinical features. Is your exam OSC or on actual patients? I have never given OSC based exam, honestly. Diagnostic features, differential diagnosis, comorbidities, course and management. Ready? Let's you finish your theory exam. After that we'll talk about it. I hope these lectures, the 8 lectures of child psychiatry and the 15 lectures of adult psychiatry, 16 rather, help you in your theory exams. The day you write your exam answers, you should remember me, especially the third year students. At least I have given you something about that. If at all a question comes on this you can write. You write what I have made you write written in notes, you can't fail. Yes, this time actual patients, because OSC based exam I have not given, so I don't. Spotters I know, but OSC based exam I have not given. There were some students last year who gave DNB exam based on OSC.